Yeah, that's quite a mouthful, this title. And so Julia and I came up with this title after an interesting Skype conversation. And so what I will be doing is to sketch you 3 vignettes at local, national, and international level, and which is what I did during that conversation, and hopefully you will get sort of the same sense of the dynamic between these different levels as it applies to verbal autopsy and the use of information derived from verbal autopsy. And so these 3 vignettes has to do with a decline in HIV-related mortality, in this particular case in the Slabisa Health Subdistrict in rural northern KwaZulu-Natal. And then a discussion and interaction we had, in fact, together with Agincourt, which was the site that Julia talked about, at the Ministerial Committee for Mortality and Morbidity in Children, and then sort of an international perspective around our experience with sharing verbal autopsy data. So starting with the HIV-related mortality decline, just to also show you where all of this came from. So KwaZulu-Natal province, the northeastern district of Mkanyakudi in KwaZulu-Natal, and then the Slabisa sub-district where the formerly known as the Africa Center Demographic Health Surveillance Site is now known as the Africa Health Research Institute since about 2 weeks ago. So over the years, we have documented the decline in HIV-related mortality in this population following the introduction of various interventions against HIV-related mortality, most notably antiretroviral treatment. And sort of how over years there was a substantial decline in mortality, increase in life expectancy. And of course, I've shown these graphs to the local community as part of our feedback sessions. And in most cases, was kind of interesting. Yes, it must be very important because, yes, this data had quite, together with other similar findings in other countries, had significant impact on international policy, UNAIDS priorities, and so on, but seemed quite some distance away from the local community's understanding of what this impact means. And so that became a little bit more apparent to me when I went back to this paper published in 2013, but actually based on work that was done sort of 2007, 8, 9 by Anne Case, Anu Garib, and Elisa Menendez at the Africa Center entitled Paying the Piper, the High Cost of Funerals in South Africa. And they found that on average, households spend the equivalent of a year's income for an adult's funeral, measured at median per capita income. And also that approximately 1/4 of all individuals had some form of insurance to pay for the funeral expenses, but an equivalent number, 1/4, had to incur debt, had to borrow money to pay for the funeral. So the remaining half had to use from their disposable income to cover the cost of funerals. And of course, in this community, funerals are important, and there's an understanding that sort of what you do around the funeral has to reflect the status of the person that have died, and you owe it to the person that have died to ensure that there is a proper funeral and burial of the individual. So probably this decline in mortality should in a way be restated in the community. And this way of restating this decline came to me when at one function at the Africa Center where the former director of the Africa Center was leaving, a community leader stood up and said that, one of the great things that you accomplish in this community is that there are far fewer funeral homes or funeral businesses in Matuba than there used to be. We used to have lots of them. Now there are only one funeral home. And so therefore, probably this is the statistics that is more relevant, the number of funerals per week. And if we look at it as starkly as this, sort of at the height of the mortality, there were 16 funerals in this small community that's about 20 by 20 kilometers, one single town. So I used to remember that Saturdays, weekends, you could not drive for any distance without seeing a tent put up and a funeral happening. Whereas now there's fewer than 4 of funerals per week, which is still, of course, far too high, and much more needs to be done to reduce the mortality impact. So moving from this to the Ministerial Committee, and Kathy Khan, that Julia would know and worked with at Anaccord, and myself were called to testify to this Ministerial Committee on mortality and morbidity in children. And the question that was posed to us was that, and this has already been mentioned in one of the previous presentations, that the majority of children die outside of healthcare facilities. And, could your verbal autopsy data tell us more about it? Unfortunately, the verbal autopsy data couldn't really tell much more about what was happening here. So sort of the common thing that is done with verbal autopsy data is to determine cause of death. And so this is a breakdown of the causes of death of those that die at the healthcare facility and those that die outside of the healthcare facility. And the pattern is pretty much the same. So there's very little insight to be gained from just looking at the causes of death. And the insight is far more in the social verbal autopsy, social autopsy methods, and this participation to really understand what are the underlying situations that lead to what is the same cause contributing to death both inside and outside of healthcare facilities. So moving quickly on to the international perspective. So as many of you might know, the INDEPTH Network have shared a large data set of cause-specific mortality data derived from verbal autopsies. And Peter have shown some analyses based on that data. This is just a count of the downloads of all of the data sets from the repository. And the most popular data set on the INDEPTH repository is this verbal autopsy data set. It's been there for just about 2 years now, had more than 320 downloads. And we've just recently been contacting users of our data sets on the repository to ask them their experience with the data set, what they've done, and so on. And sort of one of the feedbacks that we received from this data set is that the age categories in the data set is more inflexible, and they would like the data broken down into different categories, or would want to themselves manipulate that and not be limited to age categories that are predefined in the data set. Now, it is potentially quite easy for us to do that, because one of the other data sets that we are sharing is a detailed event history data set at individual level that can be linked to this data set, because the data originate from the same sites, deal with the same population, so that one can really have the exact date of birth, of course, of the individual, the exact date of death, and have a detailed breakdown of the underlying exposure variables in a particular age group that you are interested in. However, There is, of course, an identity disclosure risk if we do that, because we now have date of birth and date of death. However, as many people have argued before, that this is really, from the perspective of an external user of the data, in a sense, a very remote risk. Because the data that is available here, there isn't actually any other personal identifiers associated with it. So it would be virtually impossible for an external user of the data to derive exactly who the individual is that we now have a cause of death, for argument's sake, HIV, to this person. However, we have talked about the increase in smartphone distribution, and within that, of course, access by communities that formerly didn't have that benefit, accessing the internet, being able to browse the internet, and, it always struck me a little bit that we have websites where we have our information about what we do, and often we don't think about that those websites are the very same websites that the people in our surveillance area would want to access to know what are we doing. So let's say, and I'm sketching a scenario, that, as they say in fiction, that any correspondence to real or people are totally coincidental. But in the local community, there's a young student that is in his second year at the local university, University of Zululand, in applied mathematics and statistics. We've been visiting his house for the last 10 years, so he's used to 3 times a year, Africa Center person coming to the house, collecting some information. And as a budding student and researcher, he said, wait a minute, for my class assignment, I'm going to have a look at this data repository that I've seen on the Africa Center website where they are sharing this data. And so should we be sharing this data with the verbal autopsy cause-specific data, linkable to the microdata? He would, of course, be able to combine it and start looking at the data. And as he's done it, he thought, wait a minute, when I was in my final year at school, just across the road from me, one of my fellow students that was with me in class at school died. There were a bit of talk and gossip about her cause of death during that time, but the family never really talked about it. It was all hush-hush a bit. I know, more or less when she was born, in which month of the year, because I remember actually a conversation we had about star signs and astronomy, and we share actually a star sign. So I know the month. I know very well the date that she died. There was a big funeral. It was big happening in our block. So if I have those 2 pieces of information, can I actually find her cause of death? So, of course, I know gender as well. And lo and behold, if I take our data of some 15,000 deaths, and I cross-tabulate it by month of death, approximate 5-year of date of birth and month of, there are very few cells that have more than 3 people, and most cells have 1 person in that cross-tabulation. So it's actually, for someone with some degree of local knowledge, quite easy to disambiguate the data and get to a cause of data and reveal information that you may not have wanted to reveal. And so, for me, the thing here is that a consideration at international level of sharing data from INDEPTH, actually the risks manifests itself in a very specific local context. So, just a somewhat a random observation, but I thought about that when I was thinking about this, in that this disclosure risk is one of the barriers to data sharing. And the paper we worked on and a systematic analysis, there are actually many barriers to data sharing. But the bit that I want to highlight here is and we deliberately sort of classified our source in the literature review by empirical data, non-empirical data, and non-peer-reviewed grey literature. And it's quite striking how few of the noted barriers to data sharing is based on empirical data and research. So there's actually, I think, quite a lot of work that still needs to be done to quantify what these barriers are based on empirical research. So in conclusion then, moving from the local, and Peter mentioned this question of representativity of these demographic surveillance sites, and how whenever you kind of look empirically at it, you find that it is, in fact, empirical, whereas sort of theoretically, it probably shouldn't be. But I do think, though, that on these, speaking from someone from one of these sites, there's an immense pressure on us to stop just observation and intervene. And so by the nature of that, it is almost inevitable that these populations will start to differ in more significant ways from the general population. To give you an example, in the example where I've talked about HIV, the sort of impact of ART, so we've observed that decline in mortality. Now there's a number of different interventions in place that look at self-testing, financial incentives to test, financial incentives to link to care. There's a systematic approach where when we do in our HIV surveillance, when you do rapid tests, to make sure that the person linked to care, to follow up that the person linked to care, a kind of intensive intervention that is probably not possible to generalize at the country level. And that may start to skew. But nevertheless, I think there's still an opportunity to deepen understanding of circumstances of death and its impact using the kind of techniques that have been described by Julia. So on the national level, I think sort of this illustrates again the necessity to move beyond seeing verbal autopsy as just a cause of death instrument, but to derive more information from it, given the techniques in social autopsy. And then finally, at the international level, to really understand the barriers to data sharing and confidentiality and how we can overcome those barriers. Thank you very much.